Chapter 13 of the Claywell book, Practicing Evidence-Based Decision-Making. Evidence-based practice is an integration of the best available evidence combined with clinical expertise, enabling health practitioners to address healthcare questions with an evaluative and qualitative approach. Evidence-based practice reflects clinical expertise that is integrated with the best scientific evidence, patient values and preferences, and clinical circumstances. The overall aim of evidence-based practice is to standardize by maximizing good practice, reducing costs, and improving the quality of care. It's to integrate the best available research and clinical expertise in the context of patient characteristics, culture, patient preferences, and values. To use a problem-solving approach to nursing practice involves conscientious use of current best evidence in making decisions about patient care. Defining attributes of evidence-based practice. There are three unique key features. Is problem-solving in its approach, takes into account the clinical experience of the nurse, and combines research evidence and knowledge and theory. Now, the clinical experience is a nurse's ability to use clinical skills and past experience. The attributes of evidence-based practice allows for patient values to be expressed and incorporated in the treatment regimens. Putting evidence-based practice to work. A red flag is because we've always done it this way. There are 5 fundamental steps. Step 1 is construct a relevant, answerable question from an identified clinical concern. Step 2, search the literature for the best external evidence that addresses the clinical concerns. Step 3, critically appraise the evidence for validity and applicability. Step 4, apply the evidence to your clinical concern. Step 5, evaluate the performance. Beginning with step 1 of the fundamental steps, constructing a relevant, answerable question from an identified clinical concern. This is looking at the background questions. Seek general knowledge about a disease or condition. Foreground questions. Ask for specific knowledge for clinical decisions and actions. Clinical question categories. Now, this will influence the type of search strategies and resources to be used. Types are diagnosis, therapy, prognosis, prevention, or qualitative. This is where a well-built clinical question uses the PICO model, which is patient or problem, intervention, comparison, and outcome. So an example is, say, children with acute otitis media. Should watchful waiting be considered instead of treatment with antibiotics? Step 2 of the fundamental steps. Search the literature for the best external evidence. The key is to track down the evidence. And this begins by looking at evidence-based reviews, starting with Medline. It's the largest biomedical research literature database for general information. HealthStar focuses on health sciences, technology administration, and clinical and non-clinical research. The Cochrane Library helps make informed healthcare decisions. The National Guideline Clearinghouse provides evidence-based clinical guidelines. An Agency for Healthcare Research and Quality provides evidence guidelines and technology assessments on various clinical topics. So why critically appraise? This is step 3 of the fundamental steps. It evaluates the strength of a study. And studies are assigned a level of evidence based on quality, validity, and applicability. Level 1 evidence represents the most valid reports addressing patient-oriented outcomes. A Level 1 ranking also indicates that specific quality criteria were met based on the study type. Level 2 evidence addresses patient-oriented outcomes and uses some method of scientific investigation. Level 2 evidence implies an association rather than reliable evidence. Level 3 evidence represents reports that are not based on scientific analysis of patient-oriented outcomes. So the strongest level is a systematic review or meta-analysis of randomized controlled trials and evidence-based practice guidelines. The weakest level is opinion from authorities and reports of expert committees. Critically appraising the evidence means to examine its validity, beginning with the overview. This requires knowledge of the research design and statistics, and involves looking at the reference list of a study. 3 basic questions to ask. Is it worth looking at the results of the study? Can I trust the results? Is it reliable? What are the results? And are the results relevant for the patient? Questions to ask when performing a critical appraisal. Was the review question clearly stated? Is it likely that relevant studies were missed? Were the criteria used to select articles for inclusion appropriate? Were the included studies sufficiently valid for the type of questions asked? Were the results similar from study to study? And what are the results? The review question should be clearly stated in the title, the abstract, or final paragraph of the introduction. The method section describes the research study and what assessment quality and criteria were used. The results section outlines the number of studies retrieved, excluded, and why. The data analysis section states whether the results are heterogeneous and discuss possible reasons. The summary section provides an evidence summary from the results of several studies. So step 4 of the fundamental steps is apply the evidence. The role of the nurse is a critical link in bringing research-based changes into clinical practice. Step 5 is to evaluate performance. It's knowledge that has its foundation in scientific study will assist the nurse in making optimal clinical judgment as well as formulating a sound plan of care. A nurse is using the PICO criteria to write a research question. So which section is the comparison? The correct answer is going to be number 3, beta blockers. The ACE inhibitors comprise the intervention. Improving the ejection fraction is the outcome, and patients with congestive heart failure are the patient and the problem. Limitations of evidence-based practice. Accessibility. The nurse may have inadequate access to clinical research evidence and guidelines. There are large volumes of research to sift through. There's the research language, and then complex data retrieval systems. The individual might be resistant to change. The healthcare system has system barriers such as policies, procedures, and financial accountability. Physician idiosyncrasies versus disciplined inquiry, cost-benefit issues, and bureaucratic structures. Many times nursing is split between education and service. There's just a lack of time. A lack of consensus about nursing responsibilities. A lack of communication among nurses and researchers. A lack of skills in locating, reading, and appraising nursing research data, and a lack of organizational support. Apparent gaps in research. Not all nurses must conceive of and conduct new research. However, all nurses need the ability and the empowerment to institute change appropriately based on research findings. The nurse must base scientific interventions in all aspects of the nursing process on scientific research. The barriers are lack of knowledge of the availability of research applicable to the nursing practice, lack of educational preparedness to understand the research, lack of time. Nurses are pressed for time. Lack of authority to institute changes based on research, and no clear method of launching a trial study. Research can be both simple and necessary. The simplest research for a nurse is quality assurance and performance improvement studies, using data to determine whether patient outcome criteria are being met, charting is complete, or procedures are being done per protocol. The results of these studies are used to assist the staff in achieving consistently excellent quality care. Basic research is refining concepts. An abstract idea is taken from an observed behavior or characteristic to make it usable or applicable. Research attempts to define a concept in terms of common behaviors. So variables, as the name implies, is that it varies from subject to subject, like a concept, idea, or attribute that is captured and defined within a research study. The researcher attempts to control the variables, statistically account for them, or explain them in relation to what is being studied. An independent variable influences a presumed effect. A dependent variable is that it's influenced. So the purpose of a research study would be to determine the apparent relationship between the independent variable and the dependent variable. An example to look at this is the independent variable would be the amount of vitamins that are given to subjects within an experiment. This is controlled by the experimenting researcher. The dependent variable, or the variable being affected by the independent variable, is the lifespan. Let's say someone is looking at the impact of a drug on cancer. The independent variable is the administration of the drug, the dosage, the timing. The dependent variable is the impact that drug has on the cancer cells. Let's say they're studying the impact of withholding affection on dogs. The independent variable is the amount of affection. The dependent variable is the reaction of the dogs. Here's another one. Time spent studying is an independent variable. The test score is the dependent variable. So the first step in the nursing research process is refining an abstract idea by developing an answerable question that is focused on a specific patient-centered concern. Then data collection, literature review, and statistical analysis can occur later in the research process. The literature search determines whether prior research has been done. can also identify past research related to the study, and can assist in defining the variables, formulating a hypothesis, establishing tools that may be needed to collect the data, and clarifying the problem. It may define the theory or identify additional variables that may need to be considered or controlled. It also suggests areas that are not well supported by research, and it serves to support the findings. A nurse is testing 2 types of wound care for patients of all ages, genders, and diagnoses. So what is the active variable in this study? The active variable is number 4, wound care. The researcher is attempting to manipulate an active variable in an attempt to determine whether this will have the desired effect on the outcome. The active variable in this case is wound care. The attribute variables would be conditions of the patients, their sex, and other pre-existing characteristics over which the researcher does not have control. The research process. It begins by making predictions. The hypothesis is written prediction made by the researcher with regard to the variables. It directs the research by setting limits to the study because the research will try to prove or disprove the prediction. An example is menopausal women who include 40 milligrams of isolated soy protein in their daily diets report fewer hot flashes and more uninterrupted sleep than those whose diet contains no isolated soy protein. Defining the research study, there are different ways to define the research study. The experimental design controls the independent variables and randomly assigns the subjects to study groups. A true experimental study allows for randomization and for control over the independent variable and requiring the manipulation of the variable. A quasi-experimental design, the researcher does not attempt to randomize the subjects, but does attempt to show a relationship between the dependent and independent variables. In a quasi-experimental design, strict or complete control of the variable is not possible. Quality assurance research uses data not only to determine whether procedures are being done per protocol, but also to determine whether patient outcomes are being met and if charting is complete. Defining the population is one that will potentially benefit from the study results. Selecting a sample is choosing a representation model of the entire population on which data can be easily or realistically collected. The sample size is the number of study participants. A quantitative study asks the question who, what, why, where, when, or how, describes a relationship among variables, and is highly structured and controlled. A qualitative study attempts to clarify underlying assumptions that are vague or unclear by asking what the perceptions, beliefs, or tenets are within a particular setting. It may conduct a pilot study before implementing the actual study. Checking reliability and validity is a criteria used to check whether instruments, tools, machines, and research designs will give accurate results. Reliability measures the device or technique or the instrument used to collect data by asking how trustworthy is it at gathering the intended data. Validity measures the degree to which an instrument is measuring what it is supposed to measure. Collecting data. Methods must be approved before implementing. A patient consent is needed and need to consider legal and ethical issues. Interpreting the results. This requires providing information on how the data was analyzed, what limitations were identified, and how the results support the hypothesis. A formal statistical analysis is used. Communicating the results. This is the final step. Research summaries may be submitted for publication, and this includes a section that demonstrates how the research will apply to nursing. Research utilization. Validating the research results by critically reading and evaluating to determine whether the research has applications to practice. Direct research utilization describes applying the research findings directly to change practice, like implementing a new technique. Indirect research utilization enhances the knowledge base based on practice of current research available, and critiquing a research study are examples of indirect research utilization. Persuasive research advocates for a practice change based on research findings, like working on a policy and procedure committee. This is an example of a persuasive research utilization. Identifying areas for research. Objective evidence from clinical observations gathered from patient care experience can really begin to spark ideas for research questions. Staff nurses can take part in a study through data gathering or testing new procedures or products. All nurses should bring research into their daily practice, and it will ultimately help improve patient care.